Do you know how Medicare works? By the end of this video, you'll know the facts about Medicare so you can prepare yourself and your family. We're Shannon and Michael, the founders of Healthcare Genius. For more information about healthcare and retirement, subscribe to our channel and click the bell to be notified when we have new videos.
So how does Medicare work? Well, first of all, you have to understand Medicare is the national healthcare program for people who are over 65 and for those people who have certain illnesses like end-stage renal disease. They can actually qualify for Medicare before they're 65. There are 4 parts to Medicare. Part A, which deals mainly with hospital costs. Part B, which deals with doctor costs. Part C, which are Medicare Advantage plans, and we'll talk about those in a little bit. And then Part D, prescription drug program, which was implemented under the Bush administration and helps people cover their costs of prescription drugs. So, how does it work? Well, first of all, typically 3 months before you turn age 65, you start getting notices that you're eligible to sign up for Medicare Part A and B. This comes from both Medicare, and then you'll also get quite a few flyers from people who have your name and know your birth date. And so you'll actually have that first 3 months prior to 65 to actually sign up. Let's say your birthday is June 8th. You actually qualify for coverage on June 1st. So you would start or be able to start signing up for Part A and B in March for that June date. You also have the month of June to sign up, and then you have 3 months after that. So that's kind of your initial enrollment period that you're able to sign up for Medicare.
And what happens if you don't sign up in that period?
So there are certainly penalties if you don't have coverage, and but for a lot of people, if they're still working and they work for a large employer, Medicare defines that as 20 or more employees, then you're not required to sign up for A and B. With the exception of if you start getting collecting Social Security, then you do have to at least take Part A, not necessarily Part B. So that's kind of the enrollment period. It gets a little tricky. People get confused because they feel like if they don't sign up right when they're eligible, that there are penalties. And if you're working still, a lot of times it may not make sense to sign up. So that's as far as signing up for it. I'll let Shannon go through a little bit about what it doesn't cover.
Part A that Mike mentioned was hospitals. There is a deductible of about $1,300 for each benefit period. And then after 61 days in the hospital, there's a coinsurance of $341 per day. So what that means is, for example, let's say you had a shoulder surgery. You went in, it was a $20,000 surgery, you still have to pay that $1,300. And so it's, of course, a lot more affordable, but it's still not free. Now, let's say something went wrong for whatever reason and you end up being in the hospital for more than 2 months. Once you hit day 61, you're still responsible for paying that $341 per day after that initial 60-day period. Part B, which is doctor and physician coverage, there is an annual deductible of $185 a year, and after that, you'll still be paying about 20% of the Medicare approved costs.
Those numbers do change on an annual basis. Medicare comes out with what their deductibles are going to be, so we're kind of talking about the 2019 numbers, but 2020, those could be different.
Part D can get pretty confusing. Now, Part D is drugs, and there are different Part D programs or different Part D parts that you can buy. The premiums might vary and the coverages might vary, but do understand that after you've paid your premiums for Part D, there are still costs that are associated with the drugs that you're buying. Now, a lot of these drugs can be extremely expensive, which is why it makes sense for most people to buy Part D, but there still are out-of-pocket costs that are associated. In 2019, the maximum out-of-pocket amount that you could spend was about $5,100, and now for 2020, it's changing to $6,350. So that is a high number for some people, so just realize that.
And Shannon, one other thing too, when you're thinking of Part D prescription drugs, if you're coming off of an employer plan, you're typically required to make sure that your plan was credible. Your employer should give you that information. Where this really applies is if you don't sign up for Part D coverage when you're initially eligible, which sometimes people think, well, I don't take drugs, so I don't need to sign up, or I don't have any prescriptions. If you wait to sign up for Part D when you're eligible, again, with the exception of those large employer plans, then Medicare will charge you a penalty when you ultimately sign up. Those penalties start at 1% a month, and they are for the lifetime of your Medicare coverage. So make sure that if you decide not to sign up, that you understand what those rules are.
So how about you? Are you on Medicare? Are you close to signing up for Medicare? Do you have family members that are getting close to that time? Or are you just planning ahead? Comment below and let us know your thoughts.
Great, thanks Shannon. So Part C, we mentioned Part C. Those are Medicare Advantage plans. That's essentially where the government is looking to a private insurer, paying them a premium to take on the responsibility of providing coverage to a participant. This year, I think in 2019, about 30%, a little more than that, 33% of people who are on Medicare signed up for Part C Medicare Advantage plans. So they become very popular. Matter of fact, in the last 10 years, that's gone up about 50% the participation. Shannon mentioned this, but typically they cover both drugs and the hospitals and doctors. Oftentimes they have no copay or premiums that you have to pay, although some plans offer richer benefits, which you'll pay a premium for. But that's one of the nice things and why people like them is that they don't necessarily have to pay an upfront premium for the cost of those plans. Do remember, though, that you're going to have to make sure that your doctors are a part of the network on those plans. When you look at original Medicare doctors do participate and not participate, so kind of the same thing. But when you're talking about Medicare Advantage plans, the insurance companies that offer them do typically have networks that you need to be aware of.
We've talked a little bit about what Medicare does cover. What are some of the big things that it doesn't cover? One, dental. The majority of people get dental insurance through their employers while they're working, but when you retire, you might think Medicare kind of covers everything. It doesn't cover dental insurance, which can be expensive. Also vision. As we get older, most of us require that, so it's something to think about. And also hearing aids. Another thing that's pretty common over the age of 65, none of that's covered by Medicare, so it is something you should be thinking about. The other big point that we really wanted to touch on is that long-term care. The majority of long-term care services are not covered under Medicare. Now, what is long-term care? Think of nursing homes, in-home care if you need somebody to come in and help you out with things around your house as you get older. Those aren't covered under Medicare. That's also Alzheimer's, dementia.
Yeah, and Shannon, just one other thing. People oftentimes do think that Medicare covers long-term care costs, and where they get confused is Medicaid is traditionally kind of the last payer for long-term care costs. So when somebody maybe doesn't have any more assets or they've spent all of their assets in a nursing home, then Medicaid takes over a lot of times to cover those costs. Be aware, though, that it's not always the best way to plan for long-term care because there, again, are income qualifications. They do income and asset. Those change from state to state. And oftentimes there aren't many Medicaid beds that are available.
If you'd like to learn more about what your costs will be and about how to manage these costs, feel free to become a client by going to our description and clicking on the link there. Also, don't forget to subscribe and to click the bell to get notified when we come out with more videos. Thanks.